Welcome and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. Now that we've started our new year of 2012, I'm sure many of us have a lot of resolutions that we would like to see come to life. Joining us here on the Beyond 50 radio program today, if many of you have decided that anxiety, depression, and ADD are things that you would like to help heal, then this is certainly a way that we can find out how we can do that. On our program today, I'd like to welcome our guest, Ms. Dr. Noel Thomas, and she's going to talk with us about how we can use neurofeedback technology to be able to achieve these goals. Dr. Thomas, thank you for joining us here on the Beyond 50 radio program.
Sure, thank you.
Now, tell us about what it is that you do. I know that you're a naturopath and you're based in Portland, Oregon. How you got involved with this particular technology in your field?
So I actually underwent the neurofeedback therapy about 14 years ago myself, and found it to be incredibly powerful for shifting how I paid attention, how my mood was, how I was able to regulate my mood, anxiety. And so I just started volunteering and working with the kids at the school that they were actually training through a pilot program to help shift their attentional mood and behavior issues. And so it just really drove my excitement for this field because I experienced the changes personally, and I saw such dramatic changes in these kids that were undergoing the neurofeedback therapy.
Now, think about this now. You said 13 years ago, but this has really been around for quite a long time, hasn't it?
It has been, actually. So it's one of those things where I wish more people did know about it because it's a non-pharmaceutical approach for actually getting more at the root cause of these issues. And it came out of UCLA back in the late 60s, early 70s, and it was kind of a serendipitous discovery that we could actually shift how our brain and central nervous system function, and we can actually create more stability and more flexibility in that system and have these great effects of improved mood, improved focus, reducing anxiety.
I know that I believe it was back in the early 90s that I was actually looking into myself, how do I get more focused, how do I get more follow-through? As a young child back in the early 1970s in grade school, I was allegedly diagnosed with attention deficit disorder. Mm-hmm. I remember I was being put on a pill that they were suggesting that I take a full pill a day to function well in class. My mother said, after seeing what that did, she says, well, forget about that. I don't want a zombie as a child. Went down to half a pill, and then altogether she just said, nonsense. I'll just deal with it the best way that I can.
Yeah.
And looking back on that, it's really tough, and I guess I'm appealing to our listening audience out there with children who may be going through some of the things that I did back in the day, and that was, for instance, being partitioned off in class. I was always in a desk by myself outside of the group because I was disruptive. Seemingly, kind of always getting in trouble for mostly disruption of class, but not that we really intended to do anything to be bad people kind of a thing. But that creates a sense of isolation and loneliness, so you can see later on in the years you might have things like depression.
Right.
But at the same token, like I said, my own mother was like, I don't want a zombie. We're just going to figure out a way through this. And looking back, I didn't see anything really abnormal about me and my behavior. I was just a boy who wanted activity. But think of what happens to all of the children that go through this,
right.
That may be put on drugs, for instance, and they think, okay, bam, they've got zombies. But that has a real serious long-term effect, even worse than what I think I went through.
Mm-hmm. Mm-hmm. Yeah, it's so common, in this day and age that kids are medicated because that's, what the mainstream system is advocating for. And it does have side effects. Certainly you're giving these very powerful medications to these little bodies and brains, and they're still developing. So it definitely has implications and side effects and really doesn't get to the root cause of what's going on, because if the brain chemistry, or in the case with neurofeedback, we're treating the bioelectrical activity of the brain, which then improves how the brain works and the brain chemistry, we can actually shift things more from that from the ground up and get the brain to regulate better on its own, and so then people are not reliant on medications, which is, a phenomenal thing because it really puts everything on its head in terms of thinking that it's all biochemically related.
Ah, well, of course, the brain, geez, that's like a super electric center all by itself.
Right.
Now, here's an interesting question, Dr. Thomas, is this, okay, what do we know more about attention deficit disorder these days? You say that it seems to be a bioelectric phenomenon more than a biochemical one. Mm-hmm. What do we know about what it is and what happens in the brain that seems to be different than, say, a normal functioning person, mm-hmm. if there is such a thing?
Right. What is the normal brain, right? We know that there's what we call in this field dysregulation. So there's areas of the brain that have to perform at specific speeds in order to capture and communicate the electrical information to the next group of neurons. So it's a big neural network with this electrical activity. And if the timing is off, if parts of the brain are operating too slowly or too quickly, those communications, it's like a cog in the wheel, and things get disrupted and delayed. So we may see hyperactivity. We may see someone spacing out. They can't, attend to their homework or their job and that kind of thing, because the speed seems to be off in the brain. And so the neurofeedback helps to re-regulate that and get the brain to correct that on its own, and the brain is able to maintain these changes because of that what we call that plasticity of the brain. Mm-hmm. So in that way, it seems that we're getting to a deeper level. We can certainly change things with taking a pill. We can speed up our brains with those medications that do that for things like ADD. But again, it's kind of a Band-Aid. So once you get off of that pill, are you going to have the same problems crop up that you had to begin with?
Mm-hmm. I sometimes, wish that, pharmaceutical drugs that are available out there for people would have the same ban as cigarettes and seemingly alcohol have as far as direct advertising goes.
Right.
You used to have commercials back in the day that advertised cigarettes and even alcohol. Cigarettes, you can no longer do it, but you still see them on billboards, but they don't have probably the same effect. But the fact is what you see a lot of this day and age is, this unknown symptom that you might have. All of a sudden, here's a drug that's going to take care of this unknown symptom you didn't know you had. Mm-hmm. And before you know it, people are going after these things, trying to cure these unknown symptoms they thought they had that they now have, and now there's a drug for this.
It's a vicious cycle.
It's pretty interesting how all that works.
And we're bombarded with that information, of course, on advertising. And
mm-hmm. And you take a look at something like what you have here, which is the neurofeedback therapy, which, again, has been around since the late 60s. And I remember, again, I was reading about it in the early 90s going, this seems hopeful. The funny thing about how it was described is I go, this makes a lot of sense. And I wasn't a scientist or anything, but to me, I thought, well, I've tried other things, but this made sense. And tell us why this makes sense. I know you touched on this, but why this makes a lot of sense.
Well, it's a way to really tap into really the extraordinary ability of the brain. The brain is very perceptive. It can learn very easily, given the right stimulus. And again, that plasticity that we have the power to actually shift how our nervous system functions. Mm-hmm. People do this all the time. They're drawn to meditation or exercise or coffee or different variables that shift how we feel throughout the day. But imagine being able to regulate ourselves better naturally without really having to think about it. The brain has that capability given the right stimulus and the right information. And this type of treatment, which is a non-invasive type of treatment, helps guide the brain or shift the brain into that improved self-regulation. So it's increasing that flexibility so we can shift in and out of states more easily. We can fall asleep when we need to fall asleep and stay asleep and wake up, feeling more energized and just, kind of, again, being able to do things a lot more easily without as much effort. We definitely have that capability, and this taps into that. There are, there's other modalities and tools out there, but this is a powerful one, especially when people have tried other things and aren't getting the results that they want.
Now, Dr. Thomas, you've been working with this particular modality for quite a while now, I understand?
Mm-hmm.
Okay. How have you seen the difference between how you've worked with people in this realm versus following what would be the traditional route of, let's say, maybe talk therapy, I guess, or cognitive therapy, or even medication?
Yeah, and I see talk therapy and cognitive therapy as very much a partner in this work.
Mm-hmm.
A lot of there's more and more interest in this in the psychotherapeutic realm because it's such a good pairing with helping someone to better understand themselves and their patterns, their behavior. This is getting deeper with the neurofeedback because we don't really, it kind of bypasses our conscious mind, and because we're directly engaging the brain, the central nervous system, we can work with people who don't necessarily want help or don't know that they necessarily need help, really young kids and adolescents and kids that are having issues that they're struggling. They don't know any other way necessarily, but this, because this is bypassing what we're thinking or how we're thinking, it's able to go deeper than talk therapy is, because talk therapy, of course, depends on how willing we are to communicate and our communication ability and our awareness. And this is just really talking to our brain, and so we can work with people that are a little bit more impaired and see things shift for them and see things change for them in a way that other tools may not always have that ability. But again, for a lot of people, I feel like talk therapy is a good pairing with this therapy. Now, I see a lot of patients that have been through a lot of talk therapy throughout the years, and they've been on a number of different medications, but there's still that residue of them feeling like something's not right. They're still depressed. They're still anxious. They're still having problems with relationships or with their job and things like that. And so this is, again, getting deeper in terms of working with how our, just the health of the brain and how it functions.
Now, what does a person experience as they come to you and they want to use this modality for healing? What goes on?
So we do an intake, and we assess what areas are needing some better, again, that word self-regulation and improved communication in the brain. So usually we'll put the sensors then on those areas and read what's going on with the EEG activity, and then that information is essentially displayed back to the person in the form of an interactive video game. They're getting actually visual, auditory, and tactile stimulus back in response to what their brainwave activity is doing. And so it's kind of like the brain looking at itself in a mirror. The brain gets that objective information on its own performance, and then it's gently guided to improve certain types of brainwave rhythms, or just kind of pay attention to certain rhythms that it's rewarded for through the game.
That sounds like fun.
It is. It's very cool. Yeah, it's very interactive, and watching a movie or a game and holding the teddy bear that vibrates. You're you're given certain sensory information that the brain is listening to. And because the brain is so perceptive, it's correlating the activity that it's producing with the EEG with the sensory information that it's receiving. So it's a direct feedback loop back to the nervous system, and it shifts its brainwave activity. It shifts its attention to the different patterns that we're setting with the software.
You know, I'm curious, because this has been around for looking at, 30 years at least or more, that people this day and age really don't know that much about it. It doesn't seem to be out there even approaching the mainstream. You know, it's sort of like, now we're calling it natural medicine or holistic medicine, or we're calling it all these things even though it's been around thousands of years. It's sort of like there's a denial to allow things that have worked for centuries to come into the way things are working now, yet the things that are working now, in some cases, really don't work all that well.
Right.
But here you've got something that's non-invasive. Sounds like it's a lot of fun.
Yeah.
And that from your experience not only works, but it really takes hold, and it's a very lasting thing, it sounds like.
It is. It is lasting, because once the brain has learned these new skills, the brain runs with it. The brain wants to actually heal, like the body. The body will naturally heal. You get a cut, you clean it, the wound heals over. I mean, there's just this drive in our whole system to go towards that, more efficient communication, which just, the effect is that everything just seems to work better. And so, again, it gets back to that timing within the brain and that and helping the brain to regulate itself. And again, in a way that is very easy. The patient gets to sit back in a comfortable chair and watch the monitor, and the brain does it, because the brain wants to learn. It's every opportunity it has to learn, and it can shift its activity because we're capitalizing on that plasticity.
Now, what kind of feedback have you gotten from people, both, let's say, children? I'm sure you work with children as well as adults. What have you commonly heard people say after, approaching this therapy?
Oh boy, well, lots of things. The patient that I just had in here later this afternoon.
I can tolerate the Kardashians a lot more.
Oh, yeah, right. Yeah, I mean, it can be life-changing, honestly, and it's rare not to make an impact into what's going on for the person. So, I mean, more often than not, it truly can be life-changing, because people are struggling with these issues, and they don't necessarily know where to turn or what's out there, or medication is not necessarily, helping them to the degree that they may need some of the help. And so with kids, for instance, teachers and parents say, this is like a different child, after a month of training. It's like, they have a different child on their hands. They've just opened up a whole new world for this young person to experience life in a different way and go on a different path. So it's incredibly rewarding. I can't imagine doing anything else, because it does touch people very powerfully.
It sounds like it really does. Give us an idea of, let's say, one of the more extreme examples that you've worked with and the kind of turnaround that you've seen. And, again, we don't want to encourage the listeners that what you want is a perfect kid, like something from, what was that, the Stepford Community, where they're just totally obedient. You want them animated, but you want them realizing that there are things that they want to have and achieve, that they can go about doing these things. They can do well, because it can get pretty rough when you kind of feel like you're bumped off the road and you're not part of what's going on. Right.
Yeah, I mean, the reading level has, gone up dramatically in some kids that were way behind in their grade and on the edge of really failing, and all kinds of different behavioral issues, and I can't stress enough how life-changing that obviously is. So it is amazing that I can't wait for the day where it's more of a household name, you know. And
Yeah.
it is becoming that more so for sure in terms of the awareness of this tool.
So like I was asking even before that, give us an idea of an extreme example that you work with, and it could be a child or it could be an adult, and then they went through this process, and what kind of a change occurred there?
Yeah, I mean,
what they were in there for instance.
Yeah. Well, for instance, working with a woman who had a lot of different challenges in life. She'd had multiple head injuries, including pretty significant trauma from abusive relationships, and just kind of appeared like there wasn't any life left in some ways, right?
Oh, no.
Yeah, very, very, very difficult situation. And we've done about 8 sessions with her now, and she came in and said, I have my life back.
Mm-hmm.
She is, she's a powerhouse, but you would have never known that previous to this. There were a lot of more kind of mental, emotional issues holding her back, and the head injuries that had caused obviously enough damage to help, accelerate that dysregulation into a lot of disorganization in her life, and not able to pursue what she wanted to pursue because she didn't have the attentional skills, and things kind of, she would just fall apart essentially when she would try to get something together. And so we're seeing that just completely, pretty dramatically shift for her, and things are just kind of opening up.
Mm-hmm.
So I mean, it's actually kind of not unusual for some of this work. I work as a naturopathic doctor, as you said, and so I'm working with people with their diet, with certain maybe supplements that would help facilitate how their brain is functioning and things like that. So a lot of times, they're kind of getting the package deal with doing the neurofeedback therapy and getting help in some other areas that might need that.
Dr. Knoll, I have to say I am shocked that you use a holistic approach as a doctor. That's just ridiculous.
I know, isn't it, though?
That's just the silliest thing I've ever heard.
Right,
Why
right.
do the holistic treatment? Just do one thing at a time. Treat a symptom, quit screwing around with the root causes.
Yeah.
It just makes no sense to me.
Take the magic pills, go home, and don't call me.
Now, here's an interesting thing I'd like to approach for our listeners as well. Again, we've really, in the last couple of years, really touched on the brain, and I got more and more excited about, thinking and how we become who we are, and it really, you've read about this stuff, or I've read about this stuff for years, and you're like, oh, yeah, that makes sense, but nothing really ever seemed to change. But then all of a sudden it started to, it's like this awareness for me through all these wonderful experts just like yourself who come on the program, and I started going, I couldn't be that easy. It couldn't be that easy to have and to change and to be who you want to be.
Mm-hmm.
But even though as children we knew this, we practiced it every day fearlessly. When we wanted something, if the ball was in the road, we didn't care that 13 trucks were coming down the street at full force. We ran out and we got the ball. But the funny thing about that as we become adults is we start pulling back and we start not counting on ourselves and the magic that occurs in life from the simple, I wished I had and it comes true. The mystery seems to disappear for us. Mm-hmm. This, I could see, would create a lot of anxiety and depression for a lot of what would be known as normal functioning adults.
Right.
Now, here's what's interesting about that, is that I came across a book one time where I was reading, and I'd never heard this before, but it makes a lot of sense, especially when you think of post-traumatic stress disorder and our veterans.
Right.
That the brain, its main function, is not necessary to learn. Its first main function, from what I understand, is that it's built for survival.
Right.
Okay? Now think about a war-torn veteran who goes out and goes into battle, or even the fact that they may go into war and they never do, but the idea that you may lose your life. The brain sticks itself into survival mode, that flight or fight system. That's what we're hardwired for, that reptilian side, okay?
Uh-huh.
But then it sticks with you. So even the most subtle things, like your boss may want to talk to you in the office, boom, you get that jolt, that anxiety, I'm about to be fired, and so you're in protective mode. Hey, just wanted to let you know what a nice job you've been doing,
Right.
But you see how people live like that day in and day out and why they would turn to pharmaceuticals, which could help. But, to live that way is not an easy thing to live with, and I could see where something like this would calm a lot of that down.
Yeah. I'm glad you brought that up. Actually, the military is starting to use neurofeedback therapy for PTSD and finding, almost in disbelief, how powerful it is for these soldiers.
Because it puts them in the here and the now, much like meditation.
Yeah,
right.
yeah,
Okay.
yeah. It's literally helping directly heal the trauma. The brain is able to release and let go of the effects of that trauma and get back to more of that balance, that homeostasis that they had prior to the trauma that they experienced. And so it really speaks to how adaptable the brain is. The brain can adapt to trauma and be stuck in that, but the brain can shift out of it and get unstuck. And so it can go either way, So without the support, without the help and kind of guidance, it unfortunately, yes, we have a lot of people walking around with some significant PTSD, especially our veterans, that are having some real issues, and it's really sad because there's a lot of people that went over to these wars and that are coming back and going to be coming back, and they're definitely going to need support. We have a program here in Portland where we actually treat head-injured veterans, actually pro bono, and I can give you more information, or you could put that on your website or something like that. But we really take this seriously and see it as a really significant issue, and are trying to help these folks.
For those of you who are tuned in, you're listening to the Beyond 50 radio program. Our guest today, Dr. Noel Thomas, and we're talking about how we can relieve things such as depression, anxiety, and attention deficit disorder with neurofeedback therapy, which is a non-invasive therapy where your brain gets to play video games and actually get back on track. Now, we've talked, Dr. Noel Thomas, about, for instance, the aggravated side that we try to heal, such as the anxiety and the depression and how all this works. Now, what about people who want to maybe geared toward the area of peak performance? They want to achieve their goals, or, they want to run that marathon, for instance. And these are all very important functions that the brain plays just as much as the body does. Tell us how this might help with that.
Well, it goes back to that, just improving on what is already there. So we all probably have some area that we would like support in, and we want things to shift more easily so that we are more high functioning. So these kind of more peak people looking for peak performance, they find that there's even more ease, mental clarity, focus, attention. Really what's ideal is to have a relaxed awareness, a relaxed focus, because when we're hyper-focused, that can cause problems as much as when we're not able to focus, right? Because then we neglect other things, and that can cause issues there as well. So it really has to do with improving on what's there, and the brain is able to do that. So working with people who are performers and do public speaking and are executives, and where there's a lot of stress and a lot of demand on their performance, this attracts that crowd because we can help improve the flexibility and performance of the brain.
Now, Dr. Thomas, this is a procedure that's not just unique to you in the Portland, Oregon area, but throughout the United States, as our listeners are from all over the United States and even in some cases around the world, that they can find out more about. How would they go about Googling it and finding out maybe in their area how they can find out if they can have something like this in their area?
Yeah, there's a couple of really good directories of 2 different types of neurofeedback that I use in my office and that I definitely recommend. The first one, do you want me to give you the website?
Please,
okay.
yes, do.
www.eeginfo.com, and the other one is www.oakslabs.com, and that is spelled O. C as in Charlie, H as in Harry, S as in Sam, LAB as in boy, S as in Sam.com. So EEG Info and Oaks Labs describe 2 different types of neurofeedback, both very powerful, both types of neurofeedback that I use in practice. And those are good resources for finding an individual near you of who could help you with this type of therapy.
Very good. Now, I know this may seem like a question we should have had toward the beginning or toward the middle, but now it's at the end, and why not? Now, when a person comes to you with a malady that they want to treat, about roughly how many sessions does it usually take, and how long is the duration of each session?
I get that question quite often, believe it or not.
Yeah, we're in such a quick and easy society, but I'm saying I think things that are worth doing might take a little more time, but what you want is long-lasting results, not quick fixes.
Right. It's a learning process for the brain. So although people definitely notice changes after the first couple of sessions, we're wanting the brain to maintain those changes. So it's kind of like going to the gym. You're learning a new skill, you're building muscle memory so that those will be maintained. So I usually say 20 is about an estimation, that I throw out there because sometimes people are done in 10 or 15 sessions, and some harder, more kind of challenging issues, we're looking at 30 or 40. But it just depends on the person and their nervous system. So I usually 20 is the ballpark, yeah. And so
very good.
Yeah, so that's probably about 3-4 months of kind of ongoing treatment. And if it changes someone's life, there's no question that it's time and money worthwhile spent.
Oh, sure.
Yeah.
Think of the alternative.
Right.
Now, do you have a website, Dr. Thomas, people can find out more about your work?
Sure. That is www.meridian, MERIDIAN-ND.com.
Very good. Dr. Noel Thomas, thank you for joining us here on the Beyond 50 radio program.
Well, thank you so much.
Nothing like bringing hope to a world that feels hopeless sometimes, but not in 2012.
Right.
Thanks again.
Shedding the light.
We also want to thank you, the listeners out there. Be sure to visit us at our website at beyond50radio.com, the number 50. Sign up for our free weekly e-newsletter. We'll also post this interview on our blog, so it's archived for you to enjoy at your convenience and share with others as well. I'm Daniel Davis. Again, thanks for joining us, and remember, live your day past halfway.